G'day guys, Jason and Ninja here. Today we're talking about lower back pain and why we treat the lower back and the hip flexor all in one. So today we're going to focus on quadratus lumborum or QL, which is our lower back muscle that's in under here. So we can hit that with our traditional money spot as we come out, or we can angle in under that erector spino there. And so why we treat the QL is you can see here where the referral pattern, so QL is this muscle in here, but you can see it can also refer pain into the glute, down into the hip out here, and then shooting down there, also wrapping around into the front of the hip. And then if we look around at psoas, which is one of our hip flexor muscles at the front here, it can also refer into the quad, but also wrap back around into that lower back. So that's why if you present with lower back pain, or if you're a practitioner and you have someone that comes in with lower back pain, you always want to have a look at, where the pain is, but also look at the opposing muscle group. So that psoas hip flexor region, because that can wrap around and mimic that sort of QL pain. So we're going to demonstrate how we treat that here. So if you haven't got this book, if you are a practitioner or if you're someone that just wants to learn a bit more about your own pain, definitely jump on this book. Aaron's just purchased it for us, and it's so good at explaining why we stick to our principles and why we also treat not just where the pain is, but other areas. So we're going to show you on Ninja, the best looking 50-year-old model we've got here at MMT.
The only one.
No, we got Farnsey. Oh no, he's in his 60s.
Yeah.
So we're sinking in right into that junction point, so our classic lower back money spot. So we want to make sure that we hit that area, and then we're going to slowly trace our way around that iliac crest. So again, if you're a practitioner and you've got someone coming in with this pain, you've got to ease into this area because it can be quite sensitive. If someone's had chronic lower back pain, or if they've recently sort of had an acute injury and they're still recovering, you want to make sure that you're going slow and just, getting exception from the person on the table. They're allowing that pressure where you're not being too forceful straight away, because that's where you can cause a bit more discomfort than, we want to be that productive pain level rather than, really worrying about, I've got to push deep, I've got to get as deep as I can. It's not how deep you go, it's how you go deep. And so what I mean by that is sinking into the tissue, allowing the person to relax, accept the pressure. It can be painful, but we want it to be that productive pain. So we're doing a broad stroke with the palm there. So most of my force is going through the pisiform here, so the outside, but I'm also collecting a little bit of that QL with my thumb. And then what I can do is I can transition into using my forearm. So again, it's still a broad pressure, but it's a way that you can sort of ease into progressing into the elbow rather than going broad with the palm straight into a sharp elbow. So this way I can slowly slide around there. How's that feeling for you on the table, Ninja?
Yeah, really good, man. I had a little bit of a acute thing yesterday, a little bit of a strain from Monday night, so it's Wednesday morning
Okay.
now. But it's healed up.
Yeah.
But I suppose that I've still got the remnants of lifting and the soreness is still there from doing deadlifts and squats. So it's good to get some work done.
So you can see like on my forearm here, I've used the blade of my forearm, and now I'm slowly working into that. My elbow will now be into that lower back money spot. So it's gradually got a bit more sharp and a bit bigger of a tool. And then I can start to rotate that forearm, or I can lift my elbow and start to get a bit pointier. And just taking it nice and easy. And then always getting feedback, like if they are getting any of that referral pain round into the front of the hip, that's intelligent information that we want to know about. So I always like to check in. Ninja, getting any referral sensations or just localised?
Yeah. It's good when you get...
So that sort of information can also help to decipher where the pain is. So if it's just local in the lower back, okay, it might be a bit more lower back issue. But if you are getting some referral pain, that's another sign that you might just have to work on a few areas. So we're slowly building up to using the elbow a bit more there. And then if you are a practitioner, if you're not confident using your elbow this close to the spine, what I tend to do is just place my fingertips just on the spine there, so you know you're right next to it, but you're not pushing straight down on it. So we're right next to those spinous processes in that laminar groove. And then if you come back around this side, Leo, you can see, so here's the top of the iliac crest, and I'm spearing in that way. So it's now on that 45-degree angle, almost a ninja's opposite glute. And we're just holding there, waiting for the tissues to soften. And it's just a patience game as well, especially if it's someone that's had chronic pain. Yeah, just doing fast moving strokes. Yeah, quite often that's where a lot of other people have done that process. If they've seen a lot of other practitioners, yeah, they've had a lot of treatment on a lot of different areas, but they haven't had that focus drilled in, just targeting where the pain is, sitting, waiting, being patient, waiting for things to soften up and melt. So that's our traditional money spot, but once we go over that erector, we get to our second money spot, which is more that QL attachment, which is what we're going to focus on today. So just rolled over the erector spinae, which is the muscle group running directly up ninja's back. So once you roll over that, you can angle back in, and that'll get a bit more of QL, which is that second money spot. How are you feeling out there, Ninja?
Yeah, good. That's probably more therapeutic for me out there.
That's a bit more where you feel it?
Yeah, it's really engaging, and yeah, it's good.
And yeah, we're just staying connected to that iliac crest. So I can change the pressure, I can angle more straight down, or I can change an angle. So now we're almost trying to spear under it that way. Yeah, if you're a practitioner just looking to learn this sort of stuff, or you want to improve your hands-on skills, yeah, this man, Ninja and Aaron, are just about to start their next intake in Feb.
Yep.
When's the start date, Ninja?
19th of February.
19th of Feb?
2024. If it's, you might be watching this in future, but we run them twice a year, so you can kind of book a chat with us anytime throughout the year and see if this is what you want to learn. And it's more a mentorship, so that's what it's all about. We believe it's the best body work you can treat, you can learn in the world. You get the amazing results, but yeah, having us mentor you helps you even get into it even more, be more holistic. So that's what we're all about, is self-development, improving yourself, so then you can better help others. You can't give something you haven't got, type of thing. So yeah, that's what it's all about. It's, we want you to explore this in every way. So you watch it, you feel it, and you do it. So it's important to have a partner that you can work along with, and they can give you honest, direct feedback, because you don't want to be bullshitted. You don't want to be told that you're doing something good when you're not, and the other way around as well. So that's it.
Yeah, so coming back to the lower back here, Leo. Yeah, so we've now moved around and we're hitting the QL more under that erector. So you can see here, as I release out, the erector spine is here, so we need to get under that to hit that QL, where it comes in and attaches there, that second money spot, and then it runs up this way and attaches on almost to the top of the ribs there. So if we sink in that way, this is where we can get some of those trigger points that might wrap around into the front of the hip, or coming down around that greater trochanter into the glute. Are you getting any of that, Ninja, or just localised?
Well, I might be feeling into the bottom of the rib.
Yeah.
A little bit, yeah.
So coming up a little bit.
Yeah.
Yeah.
So it's sort of maybe where it's attaching on up under that rib, I can, or inside. Yeah, it's hard when we describe that one. Might be a bit of kidneys or something.
And yeah, the referral pain can be more of an aching, or it might be sort of a throbbing sensation, might just be a dull. Yeah, hard to describe. A lot of people are like, what's a referral pain? Like, what actually is it? So yeah, it can just be a neural sensation. It might just be like a little fuzzing sort of feeling. Yeah, it can be tingling, bit of numbness, pain. Some people get sharp referral pains to other areas. So we're just slowly tracing up that QL. Feeling a bit more as we go up there.
Yeah.
And you can sometimes feel, if people have had, if they're really tight through here, you can feel little nodules in that QL where they're coming off the transverse process. sink back out. We'll show you one more. This time we'll come off that rib attachment and work our way down. So finding where the bottom rib is. Again, just outside that erector spinae, we're going to angle in, nice and slow. Not causing any trauma to ninja there, but getting that productive pain.
Oh, it's good.
And yeah, it can be pretty brutal up under this one. And yeah, if you're dealing with someone with lower back pain, yeah, as we said before, you've just got to wait, be patient. If you are someone that's experiencing lower back pain, yeah, you make sure you're giving feedback to your practitioner if it is too intense and you feel like it's too traumatic. Yeah, you don't want to be, it's not all about, yeah, getting hammered and really feeling pain while I'm being treated. You want to feel like it's a productive pain, not a traumatic experience that's, yeah, potentially making you worse as you get off the table. And just slowly tracing down. You can feel a few more lumps coming up there. So we're just making sure that we don't flick over anything too quickly, waiting for things to melt as they come up, and then the stroke starts to move through as those tissues soften. And then we're back down to that iliac crest attachment. We're just going to slowly sink back out of there. And we'll get Ninja to just roll over nice and slow. Again, you want to make sure they're slowly rolling over. If you've just treated the lower back, sometimes that can take a bit of that stability away that the lower back's been creating. So we'll give Ninja a pillow there.
I always tell people to squeeze their abs when they...
Yeah, particularly getting up off the table after lower back, it can be, yeah.
Back.
So yeah, with our psoas, we can see the abs here for Ninja. They're quite defined at the moment. He's in good shape, so we're just going to slowly sink in. And before we really get to the depth, we're going to get Ninja to take a nice deep breath in and breathing out. And we're just trying to make sure that he's staying relaxed through there as we sink in. So if someone hasn't had it work through here before, you might just have to sit at a bit of a more superficial level until they're able to relax and allow you to get into that depth. And then if you're someone that's just learning the body work, if you're not sure if you're on psoas, we can just get Ninja to slowly lift his knee towards his chest and you'll feel the psoas muscle pop up. And then you can just get him to relax back down.
Feel it?
Yep. So you feel it push up into your hands. And that gives an indication of where we are. And we're just slowly waiting there. Reinforce the fingers. This can be a bit of an endurance one for practitioners if you haven't done this treatment a lot. Yeah, psoas, you've just got to try and... the only way you get better at doing it is just practicing holding pressure in there. Again, you don't have to go really hard for a lot of people because it is a pretty vulnerable and sensitive area.
Invasive, isn't it?
Invasive, yeah.
Look at the muscles on you, Jace.
Thanks, Ninja. A little bit of a deep deflection there, but thanks, mate. You've been pumping me up a little bit recently. You're saying I'm looking good.
I want to be like Jace.
I've actually just started. So Ninja's and Aaron have both just come off a 2.5 week or 2 week
detox.
Yeah. And I was sort of not really roped into it. I was like, nah, I don't need to do it. Not that I need to lose weight or anything like that. And then as they gradually went through the process, I was sort of getting a bit more intrigued. And then my wife was asking a few questions. So I thought, well, I've never done anything like this before. And it's more for the mental side of things and just to see what happens through that process of, yeah, eliminating or gradually eliminating solids out of the diet just to allow the stomach and the guts to reset. So at the moment, I've just started on Sunday. So we are, what are we on now? Wednesday. Yeah. So I'm liquids until 12 o'clock. So I'm just having a cocoa, which is raw cacao powder, maca powder, medicinal mushrooms, and honey. So I'm having that in the morning with a coffee. And then that gets me through till 12. And then I can start eating solid foods. So I'm going to do that until Saturday. Then I'm going to progress it and go no solids until 6 p.m. So I'll have cacao in the morning, coffee, and then I'll probably have juices throughout the day to try and get me through. I'm planning on doing that for a week, just because I've never gone that long and that consistency without eating. So yeah, that'll be a challenge for me, I reckon. And then I'm going to try and do nothing but juices and cocoa for a few days, and then I'll finish with a water fast. So we'll see how that works. But yeah, stay tuned. We might show some progress, or if you see me struggling in a video, that might be why.
You'll be fine, man. But what Jace is talking about is really important to have a plan and progress. Then you're more likely to succeed. And like when you're doing it's going to be like 3 weeks or so. Like yeah, your body adjusts and you get more and mentally adjust as well.
Rather than just the shock of going, oh, I'm going to do a fast and have nothing for 3 or 4 days. Like
going from eating junk to nothing. You're gonna so much toxin's going to come out all at once. It's sort of like drinking a big night drinking and then the hangover the next day.
Having cucumber water the next day is going to fix it all.
Yeah. So it's kind of the same thing. And like when you stop eating, like your body can direct the energy to cleaning and healing. So yeah, amazing things happen. Like pain can get out of different spots in your body, but diseases can start to unwind.
So many foods that have an inflammatory response. So if you are someone that's got chronic lower back or what we're treating today, hip flexor and lower back pain, and it's not getting any better with treatment. Sometimes it might be what you're actually putting into your body. So actually do some research and see what foods that you might be eating actually contribute or add to inflammation in the body. So a lot of processed foods, increase inflammation in the body. So you might actually have to adjust your diet, and that might be the thing that starts to help your body recover, because there isn't that inflammation around the body. Yeah, chronic inflammation is a really big problem in society. And it's not just an inflammation that you feel, but once you actually cut it out, that's what helps the body start to recover and reset. Yeah, it's not necessarily a visual thing, is it, inflammation? It's sort of internal. Yeah, especially if it's more chronic. Acute things you can see inflammation, the knee swells up, that sort of thing. But with chronic pain, it's more inflammation that you might not necessarily be aware of physically seeing it. Yeah. It's just, it takes up the space though, so it doesn't, you can't move. You can't move on the inside as well. Things can't flow around in the inside as well as they could. So back to the treatment, we'll nearly just wrap it up here. So we've just been pinning that psoas and slowly changing my angles either up that way or down towards the hip, and then we can ask Ninja feedback. Were you getting any referral into that QL or wrapping around the lower back? No. But it is pretty common that, sort of around that belly button line, you can get referral wrapping around into the QL, so straight into that lower back region, or sometimes you get a feeling down in the quad there. So there's just a bit of an explanation of the trigger points that we can hit, and where some referral patterns from that QL and that lower back or hip flexor. So this is why with our treatment process, we quite often treat hip flexors and lower back when there's that sort of chronic lower back pain. Thanks for tuning in, guys. Stay tuned for videos in 2024. Thank you. Done.